Welcome back to the 127 Fit podcast. Today's guest is a primary care doctor with Steady MD. Today's guest is Dr. Nick. Dr. Nick, I want to welcome you to the 127 Fit podcast.
I am super happy to be here, Quentin. Thank you for inviting me on.
For sure. So, Nick, we're just going to jump right into what I like to call the conversational warm-up questions. I've got 4 questions I like to ask all of my guests. The first question I have for you, Nick, is how do you start your day? Do you have a specific morning routine or morning ritual you like to stick to on most mornings?
Yeah, so my background is engineering. So, long story short, I'm a nerd, and because of that, I like to weigh. I have a body scanner at home that kind of gives me a whole bunch of data on myself from day to day. So kind of start my morning off by, to be honest, even before brushing my teeth, I will get on the scanner and kind of get a quick assessment of myself for the day. Then brush my teeth, pop a Zantac for my reflux disease, and prep some coffee. And get on my way to CrossFit. So this is pretty early in the morning, 6 a.m. And head to CrossFit for an hour or so, the duration of the class, cool down some before I leave, and then I've always felt that kind of primes my mind, primes my body for the rest of the day of work, of seeing patients. So that's kind of that's how I enjoy starting my day. And, I kind of feel like that gets the hardest thing of the day out of the way in 1 hour of your day, if I remember right from doing the math, is like 4% of your day. So in my mind, I do the hardest 4% first, and that sets me up for a successful rest of my day.
Perfect. Now, if you don't mind me asking, in terms of kind of like the scanner, like what are kind of like the details of what that scanner is giving you?
So it gives me essentially body fat percentage, lean body mass, total weight, and then it gives me circumference of my chest, of my back, of my upper arm, of my lower arm, of my waist, of my stomach, of my hips, of my upper thighs, and of my calves. So essentially, you probably heard, Quentin, of the whole thing. There's like an adage, and it's funny, you see it all over the internet, like, oh, it'll take kind of 12 weeks for your friends to notice the changes and 8 weeks for you to notice the changes and blah, blah, blah. And that's completely true. But kind of when you have this scanner, when you have something like it, the kind of, if anybody wants to look into this, the best one that you can get into, and local gyms have it. You kind of have to do some searching, but you can find local gyms that have it on their website is fit3d.com. But essentially, it uses computer vision and can deduce all those parameters that I mentioned earlier. And, it is, so the gold standard in medicine for determining somebody's body composition is a DEXA scan. The issue with a DEXA scan, unfortunately, is that it is you are effectively irradiating yourself, So when considering the risk versus reward, the risk versus benefit, I don't necessarily think that a DEXA scan is the best thing to be doing on a consistent basis, like I'm, using my machine every single day.
Mm-hmm.
So this is within, I believe, 2.5% accuracy as compared to a DEXA scan, and it's completely safe, completely harmless. It's, like I said, using computer vision. Those are the parameters it shares.
Cool. I appreciate you sharing that. All right, so Nick, the next question I have for you, is there a favorite book that you have, or a book that you like to gift often?
I would say my favorite book right now that I'm actually currently reading, you probably heard of it, I know a lot of people have, is Atomic Habits by James Clear.
Awesome. Yeah. Okay. Now, I know you're currently reading it, but up to this point, what has been a takeaway or two that's really resonated with you?
that there is no such thing as an overnight success, right? All too often, so many of us kind of, especially when there's kind of some envy or jealousy behind our thoughts, will look at somebody else and say, wow, it seems like they only attempted whatever they did that they succeeded. It seems like they only attempted it once or twice, when in reality, the way James Clear phrases it, there were attempts that were kind of behind that final attempt, that were essentially kind of storing potential energy within whatever their objective, whatever their goal was. And, that potential energy with each attempt kept building. He makes a really great analogy that the stone chipper, he can kind of chip away at whatever stone he's chipping away at, and in reality, we may see 10 or 20 or 30 kind of attempts at chipping away that stone, and really, you'll only get that 30th attempt that will successfully cleave through the stone and chip away at whatever he's trying to do. So in reality, it isn't that 30th attempt did it. In reality, the 29 attempts before it kind of softened it up, so to speak, stored the potential energy. And in reality, if you think about it, you realize that, that's an analogy that applies to everything in life. It's pretty revelatory that our day-to-day success, our day-to-day goals are really truly the product of our daily habits.
Yeah, that's a powerful insight for sure. The next question, and I've been prefacing this with, and the question is favorite quote, mantra, or word, and I kind of like to preface it with, Nick, you can kind of take this however you want. It could be a favorite quote, mantra, or word for this season of life, or it could be a favorite quote, mantra, or word from a previous season of life. However, again, you want to take that favorite quote, mantra, or word.
Yeah, I would say quote, right? So Benjamin Franklin has a pretty good one that I've always loved. If better is possible, good is not enough. And, I think that that quote applies in a most pertinent fashion, or has rather, to CrossFit. So I've CrossFitted now since 2010, and at first I was horrible at it, and it's one of those activities that truly demonstrates, if you keep at it, truly demonstrates that you can always get better, and this isn't something that I think is learned just by novice CrossFitters, right? I don't care if we're talking Rich Froning or Matt Frazier, the games winners from years past. If you see them repeat a workout that they did, let's say a year ago, still when they were games winners, they are faster, they are better at it.
Right.
So, I think that, CrossFit most specifically has shown me the truth behind Benjamin Franklin's adage, if better is possible, good is not enough. But in reality, beyond CrossFit, it applies to everything in life, right? And that's why, I made the argument with a lot of people in the past that like CrossFit has life lessons all through it. You just have to be receptive and open to it. But I'll tell you what, when you kind of become capable of things that you remember quite vividly 6 months, 9 months, 12 months, years prior you were not capable of, and all of a sudden you can do them in CrossFit, and then if you're a thoughtful individual, thoughtful human being, you can literally extrapolate that to life, and it makes you a more committed individual. It makes you someone who is much more tenacious, has much more kind of drive, and is more stubborn about your goals. So that's my favorite quote and how it applies.
That's awesome. I like that one, and I appreciate that one. I don't think I've actually ever heard that either. So The final question is a part of the conversational warm-up, Nick. Favorite or most listened to podcast?
So as I said earlier, I'm pretty nerdy. So there is a pretty awesome podcast. It's really only for doctors, so I don't expect people to know it, but it's called Hippo, Primary Care Rap. So it's just a podcast that essentially touches on different aspects of primary care and kind of continuous education, because I think a lot of people know this, right? But the thing with medicine, and why medicine is called, you'll often hear doctors say the art of medicine, is because it when you finish med school, you're technically a doctor, but big deal, right? I finished med school in 2015, and technically since then I've been a doctor. I can't tell you how many things have changed in medicines since 2015. So if I kind of was willing to rest on my laurels and, be complacent and, be satisfied with the fact that I was now a doctor since 2015, and I know everything, then I would quite literally be behind the times.
Right.
So it is absolutely essential, at least in this field of medicine, to always be willing to accept, number one, the fact that your current viewpoints may be wrong and they may be outdated. Number two, I think it's always important to, be receptive to the fact that, even though you have your viewpoints on medicine, your patients may not be, a fan of that, right? They may not, that your go-to answer for a medical issue that they have may not be what they would prefer. So you have to be open. You have to be amenable. You have to be flexible. You can't just be the doctor who wants to put his foot down and say, no, this is the treatment, this is the way, because if you do that, then you're completely ignoring patient preference. So in my mind, it's important to always be learning, always be advancing, and Primary Care Rap podcast helps me do that.
Cool. Yeah, and podcasting, that's why I'm such a junkie for podcasts, because that's how I've really continued my learning in terms of all kinds of areas of life. There's any type of subject that you want to find, you want to grow in, you want to learn, things like that. Like, there's multiple podcasts for it. We're going to get into the CrossFit more here in a little bit with your story, but there's some really amazing CrossFit podcasts out there talking about, events, talking about athletes, having athletes on, and it's really cool. I know even Rich Froning, he has his own podcast. I've listened to that quite a bit. So
what's your favorite?
My favorite podcast? Actually, right now, there's a couple of them. One of them is called All the Smoke. It's a couple former NBA players, and they just bring on, mostly current NBA players, former NBA players. They brought on, I think, a rapper or two, and they just talk about kind of life in the NBA, and the type of podcasts I really appreciate, Nick, are the ones where people are kind of just sharing their story. That's why I do mine the way I do it. I just love the format of listening to people's stories, because I believe in the power of storytelling. It's a way that, throughout our human history, we have been able to pass on very important information is through telling story,
Sure.
and speaking. So All the Smoke is one that I've really enjoyed and appreciate right now. But I've listened to literally thousands of podcasts, and a lot of times, like, I'll have a favorite podcast for this season of life, and then things will change, and then I'll have a favorite podcast for this season of life. So it's always changing. But again, right now, All the Smoke, and it's good stuff. So all right, so Nick, I'd love to just kind of get a little bit of your backstory, a little bit of your background. So if you don't mind sharing with myself and the 127 Fit podcast listeners, where did you grow up? What were those younger years like? Were you involved in sports? Were you involved in extracurricular activities? We'll just kind of move our way up to kind of like high school, and then we'll move on from there.
Cool. So I grew up mostly in Michigan, in Lansing, Michigan. I subsequently moved to a number of different states with my mother when my mother and father got divorced. So Richmond, Virginia, Lexington, Kentucky, places like that. And essentially, in Boston, Massachusetts is where I was forgetting. Yeah, growing up, was pretty nerdy, always played a lot of video games. I suspect I still enjoy video games thoroughly, but thankfully med school broke that habit,
Right.
and I haven't played video games since. But yeah, growing up athletically, soccer was my jam.
Cool.
I was offense rather, and just enjoyed kind of the sprinting aspect. And I've always been, even when, definitely now, right? But even when I was younger, I've always been a sprinter, right? I've always been like, I remember, when I was, 10ish or whatever, always challenging people to races and always winning and smoking people. And I just loved sprinting. And I've always hated long distance running. I think now looking back and what I know about, anatomy, I think, my body, I just have more type 2 muscle fibers and not enough type 1, so I'm not an endurance athlete. So, kept playing soccer growing up. And then there was a time, essentially right before high school, that I got into martial arts. If I remember right, the first martial art that I trained in was Kuk Sul Moi. And that was pretty cool. If I remember right, it was a lot of not hand-to-hand combat, but a lot of weapons training.
Cool.
And so that was pretty awesome. And then going into high school at this point, I had moved in with my dad, and my dad had always been the one who is he's very educated. He's a doctor. He's a PhD in chemical engineering. So he always encouraged kind of me to do my best, especially kind of moving to him. I didn't have the best of grades. I actually had pretty horrible grades, and I shared with him just before high school that I wanted to be a doctor eventually. So with that, I remember he encouraged me to kind of put soccer on the back burner, because I absolutely had aspirations for soccer in a professional manner that, I don't know, who knows, right? I'm not God, I'm not omnipresent. I don't know if I could have made that happen and been a professional soccer player or not. What I do know is that if I were to have tried that, in high school, and were to, have tried to, have scouts notice me and get better and better, I would have split my focus, right? So essentially, my dad advocated for me to chill out with the soccer and focus more on high school and studies and getting good grades, and his plan absolutely worked. But thankfully in high school, so I went to a high school in Lansing, Michigan, where it was essentially the first high school to have martial arts as a class within the day. So the way they phrased it, I remember they phrased it advanced PE class. So like, oh, okay, you don't want to do PE, test into advanced PE. So I tested into it, and lo and behold, it was actually Taekwondo, and I was the part of the very first semester. And like I said, the very first high school in the country to trial this. If I remember right, it was 6th hour for us. So essentially, every single day from that moment, from freshman year, pretty much every day. I think there was one day that we didn't have 6th hour, but pretty much every day I would train in Taekwondo. And so started off like everyone else as a white belt, and slowly but surely through the years until I was a senior, kept training until I became a black belt. So upon graduation, I was a black belt in Taekwondo. I trained with some other really inspirational people that were, kind of part of my formative years, and I didn't really realize it. I trained with this guy named Billy and Jorge and Joey, and these guys who are like good friends of mine who were super inspirational to keep training, because if they would have dropped out, I probably wouldn't have stayed in. So finished high school at this point, got a full ride to engineering, so I'm going to focus here on just athletics, right? Since
Yep.
that was your question.
For
Anyway,
sure.
so got a full ride to engineering, went to Michigan State University for that. And then during that time that the 4 years I was doing engineering, I kind of pivoted away from Taekwondo, and now I was doing more judo and jujitsu, which I appreciated. I liked, kind of just stopped doing Taekwondo, and at this point, like, I'm never going back to Taekwondo. I just don't think that it has any efficacy in the self-defense realm. And with that said, I think there are many other martial arts that have more efficacy. So with that in mind, the next martial art that I did after kind of jiu-jitsu and judo was in med school. So first or second year of med school, I found this place in Ohio called Ohio Krav Maga and Fitness, and started doing Krav Maga, loved it, fell in love with it. It's very real world self-defense, created by the Israeli Defense Force, and I fell in love with it. And essentially, there was a guy there, Eric Holt, and there were some other people who every single day. So the name of this place, like I said, was Ohio Krav Maga and Fitness, right? So as you can imagine, the and fitness portion of it was CrossFit.
Okay.
This
cool.
was back like 2010, 2011, and so essentially every single day that I would finish training Krav, these guys would just bug me, right, and just talk crap. I'm like, hey man, you look like you'd be amazing at this CrossFit stuff. Why don't you not do Krav for a day or two and come do this? And I told them, I remember telling them, I was like, I was like, hey, I mean, have you guys seen yourself after a workout is done? Your CrossFit, like, you're all on the ground. Like, none of you are moving off of the ground for like 5 minutes. You're staring at the ceiling. Like, why would I want to do that to myself? That seems miserable, right? But for months, they just kept at it, just persisted. And one day, they broke me down. And I told myself going into it, I was like, I've done martial arts for so many years. This shouldn't be a problem.
Mm-hmm.
I should have good endurance. Hour later, destroyed. Guess where I was? On the ground, staring up at the ceiling, just like them. So kind of from that moment on, considering that Krav Maga is a 1 hour class and CrossFit is a 1 hour class, and now I'm in med school, right? So 16 hours a day, I'm studying. Like, I don't have the time. In as much as I faithfully believe, in whatever avenue, whatever you're doing, whether it's med school or you're in business school or, whatever your time demands are, you should find, as I stated earlier, right, 4% of your day. You should find 4% of your day to relegate to your health and your future and your fitness, right? So I told myself, I was like, hey, listen, 1 hour a day would have been fine, but I can't do this 2 hour. I can't be doing CrossFit and Krav every single day.
Yeah, right.
So I needed to sacrifice one, and I remember that was a pretty hard decision in med school, but I told myself, I was like, if you do CrossFit, theoretically, from kind of the entire ethos of CrossFit, theoretically, you could stay fit enough to do Krav, or to do jiu-jitsu, or to do judo, or to do whatever martial art that you wanted to in the future. You could theoretically stay healthy enough if you do CrossFit. So yeah, I chose CrossFit and have been doing it since. So I think at this point I'm like 10 years into CrossFit. And
Cool. And we're gonna come back to CrossFit here in a little bit. I do want to touch on just like your experience in at Michigan State, and then kind of like your educational journey. So kind of like, what was the impetus, or what was the reasoning behind going and studying engineering for your undergraduate degree, and then just kind of talk about that process of getting into med school and kind of, again, that educational experience in college.
So I realized sometime in high school, I think after the scholarship was offered to me, the engineering scholarship, I realized that, hey, you can get into med school being an art history major. It doesn't matter, right? They take everyone from every background. And with that said, I then just kind of weighed the odds, right? I was like, okay, so I could theoretically go into undergrad as a pre-med like everybody else and rack up thousands and thousands of dollars in debt. Or alternatively, I could choose this engineering scholarship that's a full ride, and in doing so, save myself thousands and thousands of debt. However, with that choice, there is an implicit risk. And I realized that in high school, the implicit risk was, are you smart enough? Like, come on, everybody doubts themselves. I doubted myself for sure, absolutely, in high school, right? So I asked myself, like, are you smart enough? Like, this is mechanical engineering. Like, it is going to wreck you. And, nothing is worse for the prospect of getting into medical school than a poor GPA. So, I played the odds, man. I'm not going to lie. I played the odds. And I told myself, I was like, yeah, it's going to be hard. And I'm risking not coming out with a great GPA and then possibly entirely nuking my chance to get into med school. But it would be free. So, long story short, I went through the 4 years. It did, it was the worst. It was difficult. But I came to find out from kind of going down that route and taking that journey that kind of just the way my mind works, right? That engineering just kind of comes easy to me to understand what the various concepts that are present in mechanical engineering. And I actually graduated with a super high GPA, a 3.75 GPA, and that actually helped. Not only now did I graduate with no debt, but that was very beneficial for med school interviews, right? Pretty much every interviewer wanted to know, hey, tell me about your path and tell me about why did you choose engineering and what did you learn with engineering, and they could tell by my answers what I gathered, how engineering had changed my mind. And I came to find out that when I was in med school, I came to find out that there are not a lot of people who come out, from the College of Engineering in any school around the country. So yeah, I'm definitely glad that I went that route. I can tell you with 100% confidence right now that probably 75% of the equations from engineering, outside of, force equals mass times acceleration and work equals force times distance, like, I don't remember, like, the equations are so nuanced, I don't remember them, right?
Yeah.
But what I think is great about engineering, though, is even if you don't remember the equations and the formulas, you will absolutely remember the core concepts, especially if you didn't memorize. I've never been a fan of memorizing. I've always been a fan of you have to understand the most fundamentals, right? Like, what is the, it's almost like an atom, right? Atoms make up everything around us, right? So you have to understand essentially the atom of whatever you're trying to learn. And if you can understand that atom, if you can understand the most fundamentals, then you don't need to memorize the bigger picture, because you can understand and formulate it in your head. So that's, I think the concepts of mechanical engineering have stuck with me. And to be completely honest, like, I tell people this all the time, right? And I think people who are not as nerdy as me maybe they can't wrap their heads around it, but in my mind, the gym is nothing else than applied physics and applied engineering, right? When you're doing a clean or a snatch, why are you keeping the bar as close to your body as possible? Because you're essentially decreasing that moment arm from your center of mass. Everybody has a center of mass, and the further you get that bar away from your center of mass, the larger that moment arm is, and the more difficult it will be. I don't care how strong you are, it will be much more difficult to snatch 225 pounds. If you're able to keep things tight, and obviously I just brought up cleans and snatches, but this, like I said, if you I love watching people's movements in CrossFit, especially people who move well, because, you know, I'm looking at it and I'm just like, you know, thinking, you know, all these principles of physics.
Yeah.
You know, you can see it if you just watch someone move, you can see it in real life, and they may not be aware of it. They may just in there be like, oh, I'm moving well, but in reality, they're doing very specific things from a standpoint of the physics of their body and moving their body through space that makes the movement easier for them. Mm-hmm. And, you know, I believe, like, that's, you know, I'm super conscious of that whenever I move, and, you know, there are definitely some things that I'm trying to improve, and I believe in improving things from a standpoint of physics.
Cool. Now, what was med school like for you?
Med school was awesome too. Med school was pretty difficult. I would definitely say med school was more difficult than the College of Engineering. And I think because that is because of there's a like literally, Quentin, day one of med school, day one, they throw so much information. They literally, it's almost like trying to take a drink from a garden hose.
Right.
You know, that's what they do to you. And I remember day one, I was like, are you kidding me? Like, how do they expect us to learn all of this? You know, and this is all presented on our first day. So, you know, med school illustrated the importance to me of finding a good group, a good circle, and you know, you guys reinforcing and supporting each other, right? I think there were 330 people in our class, and you know, we all had study groups, right? And you know, we would all help each other understand concepts outside of class that we were perhaps not able to understand in class. So it's you know, med school is essentially all about, you have to figure out a way to synthesize a large volume of information in a way that you can understand, in a way that you can hopefully understand the core concepts, like I mentioned earlier, such that you don't necessarily need to memorize anything, such that you understand on a fundamental level what's going on. And you know, it was difficult. I think med school is pretty difficult for everybody. I think I only knew one person in med school who had a photographic memory, and I was always jealous of him. Like I was like, that's incredible. But yeah, for most people, you know, most people struggle through med school, and it's fine. I mean, the struggle is what builds you. It's what defines you. So, you know, it's you shouldn't be trying to run from it, because that's what's going to make you better. So
yeah. Okay, so, you know, there's this thread kind of like in your story of, you know, the academics and then the movement, the exercise is something that's always very present with you, right? So you did a great job of, you know, kind of explaining, you know, your upbringing and the movement and the, you know, martial arts and the soccer and all these things, then eventually CrossFit, how that kind of like, you know, played into, you know, you growing up, your childhood, and then into college and medical school. So for you, Nick, just like explain or maybe just share your perspective on how important it is for us just as human beings to have some sort of movement intertwined into our day-to-day living so that we can be the healthiest, best version of ourselves, so to speak.
Oh, I think, you know, that's...
Okay.
Yeah, so I think that's a great point. Essentially, my belief structure on that is that everybody should have some form of movement, some way of expressing themselves physically. You know, research has shown that people who don't have some form of activity in their lives are much more likely to suffer from mood disorders, depression, anxiety, you know, bipolar, you name it, you know. So it's one of those things where, in my mind, I am not, I make this point all the time, I'm not a zealot of CrossFit. I don't think that it is the only way. I think that kind of like when we were growing up, right? Not to say that every family is like this, but most families will try to push their kids to find some sport that they enjoy. And I think that if, that child, that kid actually gives it a shot, they can find something, right? Whether it's for example, right? I tried basketball. I was the worst at basketball. So guess what? I stopped playing basketball. I was, good at soccer, right? I was bad at tennis. I was, really never tried much of football. But I think that the very same can be said about when you're an adult, that you need some form of movement, right? So I will tell people like, hey, listen, I don't care, right? Whether we talking Pilates, we talking Zumba, we talking P90X, it doesn't matter. Find something. First of all, to find something, you have to be willing and open to experiment. That's prima facie, that's number one. And as long as you're willing to try different activities, you will come across something that you enjoy. All too often, so I work with a lot of, overweight people. Just yesterday, I saw a patient on SteadyMD who was 450 pounds. And thankfully, she's actually, she is coming to me because she wants to lose weight. And I could tell just by talking to her, like she is very motivated. And I enjoy that. And just asking her about her physical activity, she was telling me that she actually already walks. So she'll kind of walk around her home, and all in all, that'll take her about 10 minutes. So that is pretty much the first when someone doesn't exercise at all and they would like to start exercising and they would like to clean up their diet and they'd like to lose weight, the first thing that I think in my mind is I think about it like chemistry, right? I think about it like essentially how do I lower the activation energy for them such that they are more likely to start this and stick with it, right?
Yeah.
So the means of minimal activation energy requirement is to ask someone to do something physically that they don't need any equipment for, that they don't need to go anywhere for. And the one thing that I found for most people, at least I haven't found anyone who hasn't been able to do this so far, is to walk. It's literally just, okay, we're going to start you walking. It's going to be a nice and low duration at first, maybe 10 minutes, anything that you're comfortable with. And, lo and behold, for people like you and I, Quentin, if you were to tell us, okay, you want to go exercise, go walk for 20 minutes or 30 minutes, we would laugh at that, right? But we have to realize that we have to meet people where they're. I fundamentally believe you have to meet people where they're at, right? 100%. You can't sit there and then judge them from your perspective as somebody who exercises or somebody who CrossFits or somebody who, when we do workouts, my average heart rate will be for 20 minutes, 100, 175 or 180 beats a minute, right? Yep. I can't expect that of my patient who doesn't ever exercise and only now wants to get into it. So yeah, you have to meet people where they're at. And the best way to do that I found is just encourage walking. And then there will come a time that, and what I found with patients is there comes a time when they're like, this isn't enough anymore, right? And now guess what? So physiologically, on a physiological level, they have adapted, right? And that's a beauty of the body. The body will change, body will adapt. Yes. And with that, their 10 or 15 or 20 minutes of exercise of walking will not be enough. Then all of a sudden, they're going to either on their own seek out other opportunities for movement completely unbeknownst to you, or they will ask you for advice of what else they can do. Regardless, the fact that the important part is that you initially lowered the activation energy. Now the ball is rolling, right? The reaction is taking place, and now they're essentially self-sustaining. And then they'll do, at that point, if they want to get into P90X or CrossFit or Pilates or whatever they enjoy, then I encourage it. But essentially we want to get them to the point that you and I are at, right? Mm-hmm. And what I mean by that is, I guarantee you that people like you and I, you would almost have to pay us money to not work out for a week. We literally, from a mood standpoint, from an energy standpoint, we need to move. We need to exercise. And we weren't born like this. We became like this, right? We, over time, essentially crafted this out of our minds, most importantly, and out of our bodies. So we just have to find ways to help people get there. And, the way I think to get there is to initially lower that activation energy and then support them as the ball starts rolling down the hill.
Powerful point. Now, I just want to get your opinion, your perspective on, mindset. You kind of mentioned mind just a moment ago, but the importance of mindset in terms of shifting or changing a direction as a human being that we're going. For me personally, I believe everything in life starts with mindset. So from your perspective, your opinion, your experience, how important is getting somebody to think differently in terms of, let's talk, specifically maybe about, a client that you had yesterday in terms of being, obese. How do you help them think differently to make that shift or make that change? And then I would also love to kind of hear your perspective and how you use your mind to, better yourself.
So I agree with you. Mindset is the start of everything, right? And unfortunately for a lot of people, it can also be the end of everything. All too often, how the people who are depressed and then commit suicide, and you talk to them and you listen to some of their thoughts that are born of their mindset, that is why they're killing themselves, right? Because their mindset from the get-go was not supportive of conducive thoughts. So, I definitely agree with that. I think that, so Tom Bellew, he's a guy I'm a big fan of it. He has a quote, and it says, "Whether you are strengthened by life's difficulties or broken by them is completely determined by your mindset." And I think that when you zoom out and think about what that means that you can envision your life's difficulties as 120 pounds on the bar doing a back squat in the gym, right? If you get under that bar and you do it and guess what? You do, 5 reps, 10 reps, or you go to failure, and the next day you're super sore. You can either tell yourself, "Oh, this is great. This means, I hit the nail on the head with this training, and that after my body repairs in 3 or 4 or 5 days or a week, I'm going to be stronger. I'm going to be more capable." Or alternatively, you can feel that same soreness the next day and tell yourself, "Wow, I'm broken. I'm literally never doing this again. I'm so sore. This is just too much," right? So you are quite literally choosing with your mindset that next day how you are going to approach the difficulty that you experienced the day prior in the gym. And that applies all through life, as the quote alluded to, right? So whether you are strengthened by life's difficulties or broken by them is completely determined by your mindset. So, with that said, I believe, and kind of just from what I've read of successful individuals, successful people have essentially put themselves in front of and expose themselves to failure more than most of us, right? They don't see failure as failure. They don't see failure as the end goal. They see failure as, okay, this will refine me, this will make me better, and ultimately this will lead me to my goal. So, I do think that mindset is very important. It's something that, to be honest, with my SteadyMD patients, I work on a lot. I have a lot of SteadyMD patients who see me for weight loss and for body recomposition, for gaining muscle, for losing fat, and I love helping people do that because I think that if you successfully do that, you can, I can't even name the amount of medications, the amount of drugs that you can get out of, or get off of rather, the amount of diseases and disorders that you can essentially, get rid of, put into remission, so to speak, but not technically. But essentially, if you can help someone clean up their lifestyle, you can benefit them as their doctor a lot. And unfortunately, from what I've seen, all too often, people will have the health that they have, will have the chronic conditions they have, will have the weight gain that they have, will have the lack of muscle and lack of functional ability that they have simply because of their mindset. And, as their doctor, you have to be good. You have to be capable of being able to sit down and talk with them and elicit, and slowly but surely, in a way that kind of invokes their trust and lets them know that you are compassionate and you are understanding, but that you're absolutely going to call them out on their mindset, and you're going to show them another perspective, show them another way of thinking about it that empowers them more than the perspective that they had prior.
Now, how do you personally, Nick, use mindset to better yourself and to kind of accomplish what you want to accomplish in your life? Like, do you have some mantras? Like, where do you try to hold or keep your mind, your thoughts from day to day?
There aren't necessarily any mantras. I just don't allow negativity in my thoughts and in my mind. I simply don't. I think, and that's not something I've had all life, I think that it's pretty funny to talk to you about this right now, because I remember in high school, come on, high school were formative years for all of us, right?
Absolutely.
And because of that, a lot of us had insecurities and doubts, and I don't have, at this point, it's beautiful. It's taken me a while to get here, right? But I don't have insecurities, right? Now, here's a caveat. A lot of people will hear that and say, oh, does that mean that you think you're the best at everything? And no, that you have to, number one, not have insecurities, but number two, as I stated earlier, always be willing to learn and always be seeking to better yourself. There is a middle ground, right? It all exists along a spectrum. So you definitely don't want to be too far to the right, where you're cocky and where you're overly confident in your abilities, so much so that you believe there is nothing else to learn. But you definitely don't want to be on the far left of that spectrum, where you doubt yourself and you have so much self-hatred and negativity. I think I don't necessarily have any mantras. I just approach everything with keeping negativity out of my mind, and that essentially lets yourself flourish. So cool. Just having that disciplined mindset is where it's at, and that's kind of like for me too, personally, Nick, is just like just that positivity, and it's like we have control. People have to understand, we as human beings, we have control over our mind. We have control over our thoughts, and that in turn reflects the actions that we're going to take each day, right? Just having that disciplined mind sounds like that's kind of where you settle in at, which is powerful. So I'm going to murder this quote, but there's a quote that's essentially, beliefs lead to thoughts, thoughts lead to actions, So yeah, and then actions obviously lead to the quality of your life. So yeah, you need to, I think fundamentally, number one, so beliefs and mindset to me are the same thing,
sure.
right?
Yeah,
so you need to control that base level, as I mentioned earlier. Have a firm grasp of the fundamentals, right? So that belief, that mindset, if that is conducive to your growth, it will feed everything else. If you have a negative mindset, and every thought of yours is negative, whether in evaluating other people or evaluating yourself or whatever it may be, that it's gonna, it's not gonna end up well for you.
Okay, so we've got to kind of start moving towards the finish line here,
Sure.
because you have an appointment. I want to be respectful of your time.
Thank you.
A couple things, Nick, before we do the actual wrap up here. What have you found in terms of CrossFit? What is the beauty for you personally within CrossFit?
The fact that you can never be perfect. The fact that there are so many movements that where this isn't marathon running, right? This isn't Olympic weightlifting only. This isn't anything where we can just become perfect and refine everything. And I mean, one could contend, and I mean, I think it's a great contention that even in those things, right, whether marathon running or Olympic weightlifting or single focused sports, you still can't ever truly be perfect, right? But what I love about CrossFit is just I'm 10 years into this and I'm still PRing, right?
Yeah.
I don't, it doesn't make sense. It doesn't make sense that like I'm continuing, I'm 10 years older, 10 years into this and, still getting better, right? At this point, if you would have told me 10 years ago, hey, you're creeping up on a 500-pound back squat, creeping up on a 600-pound deadlift, creeping up on, at this point, I'm past a 300-pound bench press and, hopefully 350 pounds or 400 pounds in the future. But like, it doesn't make sense to me that like, that you really can't plateau with CrossFit. You just have to, keep coming in and hammering away and having faith that the act of chipping away on that stone day to day, will result in your end goals and your end objectives. So
yes.
Yeah, I think that it's CrossFit's beautiful just because you can never hit a limit, right? You just keep improving. And this isn't something, even though I'm 10 years in, right? I've heard this from games athletes. I've heard it from Rich Froning, right? I've heard it from Jason Khalipa that, those guys who are much more capable than me and much more fit than me, and they're still PRing and they're still hitting numbers that, that they wouldn't have thought that they would have hit. So it's interesting to me, and I think that's what I enjoy most about the sport and the training modality.
Cool. All right. So before I ask you the last question, Nick, I would like you to kind of just explain and share, with myself and again the listeners, what is SteadyMD? I've come across it a lot. I'm pretty familiar with it. I've actually seen quite a few CrossFit Games athletes kind of promoting it on their social media and stuff. But specifically, just for the listeners out there that don't know what SteadyMD is, can you just kind of explain what it is, please?
Sure. So SteadyMD is essentially a new approach to medicine. The old approach that many people are familiar with is, you want to see your doctor for whatever reason, you schedule an appointment, lo and behold, you find that the nearest appointment available is 2 to 3 to 4 weeks out, right? So now you're waiting. So you wait, your issue persists, whatever it may be. That 3 or 4 weeks elapses, you go to your doctor's office, you wait in the waiting room for 10, 15, 30 minutes, an hour sometimes, because obviously, we run behind. And you eventually get in to see your doctor. And most people have noted to me that and I get it from their perspective. I also get it from our perspective, especially in residency, that, you know, they waited all this time, right? They waited weeks to have the appointment. They waited minutes or hours to get in with their doctor, and then they're in with their doctor, and all of a sudden their doctor's rushing them, right? And doesn't ever let them complete a sentence, doesn't let them express their full concerns, kind of almost rushes to diagnosis or to judgment, and it just seems like the entire encounter is rushed. And the reason why that happens is because, you know, we run behind, right? And we have so many people in our schedule. In this country, the average physician appointment with a patient is 15 to 20 minutes.
Wow.
So you come in and you have a myriad of issues, right? A myriad of concerns. And you expect your doctor, with the average appointment times that I just told you, to be able to address all that. I mean, it's simply not possible, right? Which is why, you know, I was seeking another way for myself personally, because in residency, I remember I was always told by patients who I'm very grateful that they were so honest with me. You know, they would always tell me that they really appreciated how I didn't rush them, or how, you know, I listened to them. And that's great. The downside of that for me, however, was then I was always late with my next patient, right?
Right, yeah.
And then beyond always being late with my next patient, then I would always have super long days. So essentially I'd get in, start seeing people at 7 a.m., and I wouldn't leave until 7, 8, 9 p.m. And then I'd still have to type up notes, right? Unfortunately, that's not sustainable.
Right.
We have to think about what's sustainable for the doctor too.
Mm-hmm.
So SteadyMD is what's called essentially direct primary care. It is a telemedicine-based service wherein I can see anybody in the United States as long as I am licensed to practice medicine in their state. I'm currently licensed in like 23 states. I have licenses pending currently in California, in Texas, in Florida, and New York. But, you know, the beauty of SteadyMD is you get one doctor, me, as opposed to coming in to another concern a lot of people have is they'll come in and see their doctor, and every time they'll see someone else, right? A PA, a nurse practitioner, some doctor who they've never met before. Meanwhile, they're wondering, where's my doctor? Where's my doctor who knows me from the past, right? So SteadyMD is always one doctor. You always get me. That first appointment with SteadyMD is at a minimum an hour. At a minimum, right? So none of this 15-minute to 20-minute stuff that I was talking about earlier. Mm-hmm. With patients who are more complicated, I saw a 67-year-old woman the other day on SteadyMD who our appointment was 2 hours and 45 minutes.
Wow.
And she had a litany of issues, right? She had just a number of issues. And in my mind, that 2 hours and 45 minutes was necessary because I don't want to miss anything on her, right? So let's you know, shift perspective back to if I were a normal doctor, 15 to 20 minutes, I'm not going to have time to go over her rheumatoid arthritis, her diabetes, her Coumadin that she's on. I'm not going to have the time to address all these. And if I do address all of them, then I'm going to address them poorly because I don't have enough time, right? Mm-hmm. So, you know, that's what I love about SteadyMD is that it kind of takes the stress and the kind of burden of normal primary care. Direct primary care is all about, hey, you have me as your singular doctor. Thankfully, with SteadyMD being a telemedicine-based direct primary care company, I can at any point, you know, address a patient's concern. So right now, I could be sitting with you having this podcast, and a patient messages me on SteadyMD, hey, doc, I have this issue. Can we address it? You know, just last week, I had a patient who told me she woke up with some nausea, some vomiting. I called her within 3 minutes of her sending me a message. We had a discussion. I diagnosed her with an acute gastroenteritis and sent some medication to her pharmacy within essentially within 10 minutes of our appointment,
Wow.
within 10 minutes of her message to me on SteadyMD, I had sent the medication to her. So, this isn't a normal doctor's office where you set an appointment and you have to wait many, many days or weeks or months. No. With SteadyMD, you have essentially instant access to me, and I can prescribe medications, send you labs, put in for referrals for other doctors, essentially do anything that I need to adequately care for my patient, and do so from a basis of greater understanding, since that first appointment was not cut short, and every subsequent appointment I have as much time as I want. It isn't relegated to 15 to 20 minutes. So patients seem to really enjoy that aspect. And I can absolutely tell you as a doctor on the platform that I very much enjoy the opportunity to connect more with my patients. Because you have to keep in mind, as a primary care doctor, I'm not a radiologist or a pathologist, right? Or a surgeon. And the reason why I said those three specialties is it's a inside joke. It's pretty well known in the medical community that those three specialties, pathologists, radiologists, surgeons, for the most part, they don't like talking to patients. They're not very personable. They like staying by themselves and doing their job. They do a good job, but they don't necessarily like having full-on conversations with patients and digging deep and finding out what the root cause of something is.
Right.
While conversely, I am that way. And that's why, in medical school, I knew that I wanted to do this. I knew I wanted to be a primary care doctor because, it's easy for me to talk to people. And because it's easy for me to talk to people, I can, as I alluded to, get to the fundamentals of what an issue is. And then from there, we can discuss a treatment plan, because I am very much anti-pills first. I think a lot of doctors... Unfortunately, I think a lot of doctors are very much of the mindset, and this may be because of what we brought up earlier, right? Because there's only so much time in a regular doctor's appointment, 15 to 20 minutes. So they're like, okay, you know what? Pills, what's your problem? Or because what they're essentially doing truly is treating the symptom.
Correct.
I have this issue. Okay, here's a pill that'll help with this symptom, right? That's not helping with the root problem,
Absolutely.
right? When you're with SteadyMD, and you're all of a sudden your doctor has much more time to listen to you, then guess what? We can kind of flesh out the root problem and come up with a plan to attack that instead of mindlessly throwing medications at you.
Now, quickly, if somebody wants to connect with you through SteadyMD, what does that process look like?
They just go on the website. I believe it's just www.steadymd.com. There's a link, I believe, Mission and Teams, that with that they can see all the doctors on the platform, and they can find me if they'd like to sign up with me, or find any other doc if they'd like to sign up with any other doc. That's essentially how you sign up.
Cool.
And it definitely be. I already have a number of patients here in Colorado, and I have a number of patients all around the United States. But I'm still accepting patients locally. So
cool.
Yeah.
Okay. I'm not going to ask the last question. I just want to give you the opportunity, Nick. Do you have any final thoughts, or maybe some final words that you would like to share with the audience today?
Ooh, that's a good one. You know what? No, not really. I mean, there's nothing I can think of on a whim like this. But yeah, I genuinely appreciate your time.
Absolutely.
And having this podcast that so many people listen to and enjoy, and turning me on to your podcast. I didn't even know about it until we touched base. So yeah, I appreciate you having me on, and kind of letting you speaking with candor to me, and kind of letting me speak with candor to you.
For sure.
Yeah.
And so I want to thank you in turn for the opportunity just to connect with you in person And I appreciate you sharing your story and touching on some of the things that you've learned over the years. If somebody wants to find you on social media, kind of follow your journey, where can my listeners connect with you on social media, Nick?
So I am pretty much predominantly on Instagram, but I also do have a Facebook page and I also do have a Twitter page. But pretty much, like I said, right, it's pretty predominantly Instagram, and the handle there is the fittest doc, which if you had listened to any part of this interview, I'm sure you're able to figure out why I picked that name. And I think like I alluded to earlier, right, you have to always be on a journey to create the fittest version of you, and to realize that you will never be perfect, but you can always improve. So yeah, I made that username to try and focus on hopefully inspiring people to become the fittest version of themselves. And yeah, I love kind of touching base with people on social media, on Instagram specifically, and yeah, so the fittest doc.
Cool, cool, awesome. All right, 127 Fit Podcast listeners, once again, I just want to thank you so much for your listening ears. If you'd like to find out more about my guests and myself personally, you can find that information on Instagram at 127fit. Facebook is at Quentin Vars. LinkedIn is at Quentin Vars. If you guys would do me a huge favor and please leave a 5-star rating and review, that would be awesome. And also subscribe to the podcast. And if you think you would be a great guest, or if you have a friend or an acquaintance you think would be a great guest or guest for the 127 Fit Podcast, please send me an email or give this email out. The email is 127fit@gmail.com. And as you guys are finding great value in a specific episode or episodes of the 127 Fit Podcast, another huge favor I'd ask of you is that you would take that specific episode or episodes you're finding that great value in and share it on your Facebook and Instagram stories using the hashtag #BeSomeoneToFollow. And per the usual, I will leave you with Proverbs 24:10, which states, "If you faint in the day of adversity, your strength is small." This time, until next time, I will catch you guys later.